Our listeners always come through, and just before we ended the last hour, we were talking about shrinkflation, right, at grocery stores, and that's easy to define, right? Shrinkflation, you go to the grocery store, you buy a package of your favorite item, and now there's 25 less grams, right? So they have reduced the size of the box, they're charging the same price. That's shrinkflation. And somebody brought up the fact that you go to the grocery store now, and sometimes they make you buy 2, 3, 4 of the same item in order to qualify for the discount. And I realize we don't have a great word for that. Shrinkflation, that just rolls off the tongue. But what is it called when you're forced to buy more than one item at the grocery store? And our listeners have come through, okay? Brian, very clear. He says it's called extortion. And I love that. And somebody else threw in that it should be called multi-steelification, which I like, but I don't know if it just rolls off the tongue. Maybe it's a little long. Now, Mark in NDG says it should be called creeping authoritarianism. I don't agree. I think it's capitalism. And you can still just buy one. You just have to pay more. So relax, Mark. I don't think it's authoritarianism. But I got to say this. I did get one listener who says, Elias, you should call the bulk purchase for discount multiflation. And I absolutely love that term. So we've coined it. I don't know if anyone else has done it before us. Multiflation. That's what we're going to call it. Now let's turn our attention and switch gears. Completely different topic. Quebec's doctors are facing investigations for their overprescription of anti-anxiety medication. The misuse of benzodiazepines is sparking concern across Quebec. Benzos, as they're called, class of drugs that treat anxiety. Among other disorders, they include brand names like Valium, Xanax, and Ativan. But their overprescription could be causing more harm than good. Dr. Chris Labos is on the line, cardiologist, degree in epidemiology, and you hear him on Weekends with Ken on Sundays. Hi, Dr. Labos. Welcome back.
Oh, thank you for having me back.
So what's your take? Are we overprescribing these anti-anxiety medications in Quebec?
I mean, yes, I think we are, and I think the numbers sort of bear that out. Benzodiazepines have a number of issues associated with them, and while they were very popular, almost fashionable in the 1970s, I think the science has evolved to the point that if you do have something like chronic anxiety or insomnia, there are actually better, safer treatments for that, frankly, low-dose antidepressants. And so benzodiazepines, because they can become habit-forming, because they are addictive, because they have so many side effects, especially in older individuals, I think there's a growing consensus that we probably have to move away from them. It's not that they can't be used in the right patient population. It's that as a generic, treatment for everything, it's, potentially being a little bit overused and overprescribed.
And is it being overprescribed because it's easy? Like, I'm thinking about the doctors that are making the decisions to prescribe these drugs. Why is it happening? Is it just an easy fix?
Well, I think it's part of that. I think a lot of people were prescribed them, possibly like 20, 30 years ago and have never gotten off them. And if they are like, listen, I have anxiety and I'm on these medications and now I feel better and I don't want to stop, it's very hard. Sometimes it's very hard to convince people to get off of them. The other problem is, you can't just stop these medications. So if you are on a benzodiazepine and you've been on one for a while, you can't actually just stop them. You will go through withdrawal and you could possibly die. So detoxing somebody off benzodiazepines is actually really complicated. And I think in a lot of situations, because it's very hard to get access to a psychiatrist these days, I think a lot of family doctors are saying, you know what, the lesser of two evils now is to continue prescribing these medications because I'm not in a position where I can, help a patient through a detox program. So it's like, I think in a lot of situations, it's a don't rock the boat phenomenon that's keeping them in prescription.
So, Dr. Labos, 18 years ago, I'll never forget this afternoon. It was 18 years ago. In the morning, I had gotten laser eye surgery. LASIK, whatever they call it, right?
Yeah.
And after the surgery, you have to get driven home.
Yeah.
And they gave me a Valium, okay? I'd never had this before in my life. And for 18 years, I've been thinking about having it again. And I even tried, like, it's funny when I hear that these are overprescribed. I remember I went to a doctor. This is like 4 or 5 years after the surgery. And I was like, man, that afternoon when I had Valium, it was amazing. and I tried to get a prescription. I was like, hey, do you have, and the doctor was having none of it. Right. So I tried once, never happened. But can you describe, like, I still remember that sense of like I was high as a kite. I've never been I've never been higher than that in my life. But I hardly touch drugs in my life. Like on one hand for cannabis, let's say, right?
Yeah.
So what are these drugs doing? I mean, what caused that thing 18 years ago for me, where I still think about it?
Well, listen, I mean, there's a reason why these drugs are addictive. If you've never had to take opioids or if you've never had to take benzodiazepines, you do not understand how great you feel when you're high. Mm-hmm. It's the crash that comes afterwards that's problematic, but it is essentially doing that. It is removing your anxiety. So when people say, why were these drugs prescribed as widely as they did? It's because people felt great. It really does get rid of your anxiety. The problem is you're trading one problem for an even worse problem, which is addiction in many cases, and a potentially very dangerous addiction when you get into the withdrawal symptoms. So it's doing exactly what it's supposed to do. It's getting rid of your anxiety. So you're going through life without a care in the world, Yeah. But it's the down period once it wears off, and when you get patients taking very high doses of these medications, that's when you really start to get into some of the very serious and potentially life-threatening side effects.
So, Dr. Labos, what do you what should be done? Like, should there be a more strenuous process? Like, I don't know, a checklist or something before doctors prescribe these types of medications?
Well, I mean, that's one thing. I mean, certainly other provinces do have restrictions on who can prescribe opioids, who can prescribe controlled substances like this, whereas in Quebec, any doctor can prescribe anything, which is, maybe not the most ideal situation. I think there is a growing awareness amongst the vast majority of the medical profession that there are better ways to treat anxiety and depression now, because the newest generation of antidepressants are just so much better and so much safer. I know a lot of people will claim is like, we're overprescribing these, but they are better medications objectively to what came before. But for the patients who are already on benzodiazepines, if we want to get them off of these medications, downloading and dumping more and more responsibility on family doctors is not going to do it. You need access to inpatient or, structured psychiatry detox services, and those are very, very hard to access. It's very hard to get a patient off benzodiazepines because most physicians are just not qualified to shepherd them through the detox process. So if we want to get these patients off these medications, we need more psychiatrists across the province who are able and knowledgeable to help with this.
Dr. Labos got a text message from a listener. Says, it's funny you mentioned that about Valium. I also had LASIK eye surgery. They gave me a Xanax, and it was amazing! Double exclamation mark! Right? Which is just especially for people that have done no drugs. Like in my life, done no drugs. To get that, I still remember it. Anywho, Dr. Labos, we got to leave it there.
All righty.
That's Dr. Christopher Labos, cardiologist, degree in epidemiology. You catch him all the time on CJAD, especially Sunday mornings on Weekends with Ken.